PPE, or personal protective equipment. We've heard a lot about this recently, mainly with the lefties blaming the government for the lack of it, saying things like underfunding of the NHS is the reason for this, and it's all fueled by the mainstream media like the BBC, The Guardian and Piers Morgan. However, I have to say that this is utter baloney. Yes, there is a global shortage, and surprise, surprise, we are not the only country affected by this virus. The media now also refer to every NHS worker as frontline staff, when this is simply not the case. They are not all frontline staff. There are a great number of backroom staff in the NHS. If you work in cancer care, you are not frontline for COVID. You are frontline for cancer, but not for COVID. Therefore, you should not require PPE, because if every nurse on every ward would like to pose for a selfie of themselves on Facebook in their PPE, doctors, who have to do a lot of aerosol generated procedures on patients, would be denied the PPE. And this is exactly why the BMA have got into such a fuss about it. The problem is that more people think they need it than they actually do. Some staff are saying that they are scared, and this is completely understandable, but they need to remember that they are unlikely to get COVID on many of the wards in our hospitals. They just need to follow the guidelines and take the normal precautions. Now, additionally, NHS hospitals currently have 4 times more empty beds at the moment than normal, and this is due to the ongoing efforts to free up space and a slowdown in emissions from other causes. But I have to say, the NHS is simply awful in terms of management. It is so disorganised, it is so dysfunctional, and it is broken as an institution. It leaks money like a sieve. It has no cash shortage. You can't just throw money at its problems, as they are far deeper rooted. It has no shortage of clinically able professionals, but it is bursting at the seams with bloated middle management, many on huge salaries, who generate reams and reams of red tape with terrible managers, and they all have that no-can-do attitude that infiltrates everything in the NHS. Now, thankfully, the new Nightingale Hospital is not being left at the mercy of the NHS, but of the Army. Now, I believe that the Army should run the entire NHS, as they would do a far greater job at running the service than the shambolic way it's currently being done. The current shower are wasteful in the extreme, and I can see that the PPE will be a big story, but the real issue here is that the people who really need it are not getting it because of the appalling management. The NHS desperately needs an overhaul, and it needs to be run in a more military fashion to stop waste and increase efficiency, and this needs to be done as soon as possible.